All right, welcome back. Today is World Sickle Cell Awareness Day, and this morning we want to raise awareness for the disease and the challenges that the patients and their families experience. We're joined by Dr. Venée Tubman, who is the co-director of the Sickle Cell Program at Texas Children's, and we have Myles Newsome with us, who is a sickle cell patient. Myles, good to see you. Doctor, you too.
Good morning.
Thanks for being here today. Doctor, I want to start with you. Forgive me, I don't know much about sickle cell disease, and maybe there are others like me. What is it exactly?
Absolutely. Sickle cell disease is an inherited disorder of the blood. Persons who have the sickle cell disease genetic mutation in their blood, their blood changes shape within their body, and that shape change makes their red blood cells much more fragile, but it also causes inflammation around the whole body. So I say that sickle cell disease causes problems wherever blood goes. The most common manifestation is pain, but over time, sickle cell disease can damage just about every organ in the body.
Myles, can you tell us a little bit about what you've experienced and what you've been through?
So it's sort of a sharp pain that will come occasionally. It could go up and down, but most of the time it's at a constant level. Mm-hmm. Sometimes it can be hard to deal with, but other than that, it's just...
Do you remember being younger, the first time you experienced that pain and what it was like?
The first time I remember experiencing a sickle cell crisis was in 6th grade. Mm-hmm. So the first time, it was actually a while since I had a sickle cell crisis, and took me quite a shock.
Yeah.
So now it's something I live with and something I go through every day.
And doctor, what is that like in terms of, well, I guess diagnosis, first off, because you have a young man who's experiences pain out of nowhere. So what's a family to do with that information, right?
Absolutely.
Like, where's the pain even centered? Does it always begin in the same place? How do we even figure out that this is sickle cell?
Exactly. So we're really fortunate. Since about 2007, every baby born in the United States is tested for sickle cell disease. And once they receive that diagnosis, they're strongly encouraged to get connected with a pediatric hematologist. I think the best sickle cell disease care is preventive. So we work to start medications that can reduce the likelihood of pain. We work to educate families so that they can be prepared for how to manage pain when and if it happens. And then if it does happen, we work with families to make sure that the kids are finding some sort of comfort, either through medicines or through developing non-medical psychological coping strategies to help them get through and to live successful lives like Myles has done.
Yeah, so there are two parts to it, I guess, Myles. The pain, you said it's at a constant level when you feel it. Does it get worse or better at times, ever, or is it always kind of there?
Most of the time it's always kind of at either a low or constant level, but sometimes if you're going under stress or if you have triggers, it can rise, or if you have something to distract yourself, it can get lower than that to 0 or just very low pain.
Really? So how do you manage it? Like, when it gets bad, what do you do?
Well, I like to hang out with my friends a lot. I like to just go out and eat with them, whatever gets my mind off it. That's
one of the main components. So the psychological component, doctor, is very important, it sounds like.
It absolutely is. You know, and despite this, despite many patients learning how to cope psychologically, many of our patients will end up in the hospital in some cases once a month. They'll be in the hospital for a period of time to receive strong medications that will treat the pain.
Does it change over time? Does it progress? Does it get worse?
It does. It does. We know that because the sickling is causing damage to the organs, even from birth, that over the lifetime, this disease tends to get worse. So we really struggle to support our young adults with sickle cell disease because it's a time where they're trying to emerge into their lives, they're trying to live a really full life, and then the disease is getting worse at the same time. So, you know, I give Myles a lot of credit for all of the successes that he's had and the ways that he tries to persevere.
Are you a little shy when she talks about how well you're doing?
Stop.
Come on, Myles, you just graduated Bel Air High School, I understand.
Yes, I did. I'm excited that it's over with now.
High school was tough, huh?
Yes.
All right, but you're going to UH, is that right?
Yes, sir.
And what are you going to study?
Hospitality.
Really?
Yes, sir.
That's great. Do you have career goals in mind, something you want to do?
Initially I did. I wanted to go to culinary school, but now got accepted to the Conrad and Hilton Global Hospitality and Leadership Program. So there's different options for me. Maybe I want to do something in culinary still, or something with a lot of travel.
That's a great school.
Yes.
And we wish you the best of luck there.
Thank you.
If you need any connections on the way out, I got you covered too. This makes his accomplishments so much more impressive. I mean, getting through high school is tough, but we have a young man here who did it while going through treatment, while dealing with sickle cell. Tell us a little more about that challenge, and what that must be like.
I think Myles has said it best. Many of our patients require opioids to treat their pain, and some on a daily basis. So if any of you have ever had to use strong pain medicine like that, it's hard to focus. It's hard to, even if without the pain medicine, when you're just in pain, it's hard to continue to function in a normal way. Then on top of that, you have the disruption of having to be admitted to the hospital, or even just having to come to frequent outpatient hospital visits. Our patients really work very hard to overcome their disease, and I give them a lot of credit. But at Texas Children's, we have one of the largest sickle cell programs in the country. We take care of about 1,200 children with sickle cell disease, and we have an amazing team that is wholly dedicated to trying to put sickle cell disease in the background for these patients so that they can live really full lives.
That's one thing I wanted to ask you about, Myles. What was your experience like with Dr. Tubman and her team, and some of the work you've had to do over the years?
Dr. Tubman's been great so far. And she's helped me with everything, and she's given me advice on how I should handle my pain, or what next steps I should go by.
Yeah. Where does the relationship go from here? I mean, at some point he ages out from being a child, so do you two stay in touch, or how does that work?
Well, I will leave that to Myles, but it is very hard for us to send our patients to adult hematology when they're in their early 20s. But we really try and make sure that they're prepared, that they are ready to advocate for themselves, that they know about their disease, and that they find a qualified adult hematologist who understands sickle cell disease. But it's really hard.
Right. Well, he's got a great sense of humor too, though.
Yes.
Myles, what do you say to any other young person who maybe they have a family member who's watching, and that they have a 6th grader now who's going through the same thing? What do you say to a young person that's going to have to go through the same challenges you went through?
Well, I say just try to find something to distract yourself, to get your mind off the pain. It's difficult to handle the pain already. It's better if you just try to get your mind off it instead of try to focus on the pain. It will just make it worse.
Yeah. And what are your plans as you go through college? I mean, are you going to still be hanging out with some of your friends? Obviously, you'll make some new friends. What do you think you're going to do psychologically to keep you strong through this next journey or next chapter in life?
Probably still hang out with my friends. Just try to go to the gym as more, and see what extracurricular activities I could find at U of H.
Do you find exercise helps?
Sometimes, yes, and I just like to exercise.
Okay, so the pain doesn't really get in the way for you. You're able to mentally get over that.
Yes, most of the time.
Strong young man, Myles. Very impressive. Congratulations to you, and we wish you the best of luck at UH.
Thank you.
And Dr. Venée, thanks for all your help and information. If people want to learn more about the program at Texas Children's and they want to find you, where can they contact you and do that?
Please do. We're always happy to educate and to provide more information about sickle cell disease. You can check out our website, the texaschildrens.org, and there you'll find a page with our department site and a lot of information about sickle cell disease.
Well, thanks again to you both.